I'm a senior bio major at Mansfield University. Today I'll be talking about maternal and reproductive health. First, let's do an overview of maternal and reproductive health. Maternal health is the reproductive health of a woman during their pregnancy, during childbirth, and after birth, which is postnatal. It is important for all women to get the proper and high-quality maternity care. This is especially important during pregnancy because each one is unique in having complications or issues. An example can be preeclampsia, which is high blood pressure and high protein in their urine during pregnancy. Women all around the world are not getting the same high-quality treatment, and there's a higher mortality rate than in the U.S. Fully meeting the unmet need for maternal and newborn health services would also lead to a sizable decline in poor health outcomes. Due to there not being much maternal care available to those in developing countries, it is quite difficult for women to obtain contraceptives, also known as birth control. Many women have unintended pregnancies due to them not having any idea about contraception due to education or do not have access to them at all. 81% of women in developing countries have unintended pregnancies, and 160 million women are not using them. While pregnant, it is so important to have prenatal visits to be sure that the baby is healthy and well. There are about 4 in 10 women that do not reach the minimum of 4 visits, and this can risk the baby's health. Women in developing countries do not have much education about sexually transmitted diseases nor the services to treat them. There are about 1.5 million women with HIV who give birth each year. There are also about more than 1/3 of these pregnancies that do not receive the antiretroviral therapy that is needed to prevent HIV transmission to the newborns. Also, there are 3/4 of these women that do not receive ongoing therapy after birth for their own health. About 273 infants are infected with HIV each year. Also, there are 1 in 4 women that are infected with STIs, and 83% of them do not receive treatment. Untreated STIs can lead to infertility issues, HIV risk increases, and pregnancy complications and chances of a stillborn. Many women in developing countries cannot afford the treatments for reproductive and maternal health because it costs tremendous amounts. Some examples are the delivery of babies, which can cost up to $2,000 to $18,000 if out of pocket, C-sections, which are only used about 5% in sub-Saharan African countries, which just shows a lack of access to life-saving surgery, and these can cost from $1,000 to $11,000. Medical abortions, which again in sub-Saharan Africa is expensive if unsafe and can cost up to $68 to $76 million. Prenatal and postnatal care, as well as the cost of having a premature baby. The cost of contraception, as well as health care of women and STI care costs around $18.7 million. If women were to use birth control and were able to easily obtain them, it would offset pregnancy costs about $1.47 for each pregnancy. There are about 99% of deaths that are due to pregnancy in developing countries. More than half of these deaths occur in sub-Saharan Africa, and almost 1/3 occur in South Asia. Women in developing countries are more likely to get pregnant due to what we touched on before, with the lack of education and services. Every day around the world, about 830 women die from pregnancy or childbirth complications. The probability that a 15-year-old woman will die of maternal causes is 1 in 4,900 in developed countries, while it is 1 in 180 in developing countries. Every 2 minutes, a woman dies during pregnancy or childbirth, according to the latest estimates released in the report by the United Nations agencies today. The complications that account for 75% of all maternity deaths are severe bleeding after childbirth, which is 27%, infections or sepsis, which is around 11%, high blood pressure during pregnancy, preeclampsia or eclampsia, complications during pregnancy, and unsafe abortions, which is 8%. The plan to help women in developing countries is to reach over 40 countries and focus on 25 priority countries, which are mainly in Africa and Southern Asia. The sustainable goals are: the global maternal mortality rate is reduced, they end preventable deaths of women and newborns, and malnutrition comes to an end in all forms. The U.S. has contributed, based on 2022, $1.435 billion to help end preventable maternal and child death by 2035. With a strategic emphasis on reaching the most vulnerable populations, quality of care and services for mothers and children across U.S. global health efforts, the near-term goal had been to save 15 million child lives and 600,000 women's lives from 2012 through 2020 in priority countries. These countries account for approximately 70% of global maternal and child deaths. By 2030, the ratio of maternal mortality globally should be less than 70 per 100,000 live births. Fully meeting the need for these services, including HIV-related care for pregnant women and their newborns, would mean maternal deaths would drop by 2/3. Newborn deaths would drop by 3/4. The burden of disability related to pregnancy and delivery experienced by women and newborns would drop by 3/4. And mother to newborn HIV transmission would be nearly eliminated. And these are my references.